to start our introduction again. I want to welcome Dr. Judy Jasek joining us today about pet health and cancer and all these pieces. And this is the show we do every Tuesday at noon, where we're talking about so many aspects of our pet's health. So thank you guys very much for being with us and staying with us throughout all of this fun. So one thing that we're going to do today, which is I'm really looking forward to, is having a discussion about, and it's a Q&A. So this show is you. This show is driving based on all the questions that you have ever had in regards to cancer, and we will answer as many as we can in this 30, and if it goes a little bit over, that's fine. So we have 30 minutes to talk about cancer in our pets and pet health. And you get the expert. Dr. Judy Jasek is an expert when it comes to cancer. She's been a vet for over 30 years. So there really probably isn't much you couldn't throw at her where she couldn't answer. So
at least try.
Thank you guys very much. And thank you, Dr. Judy, for being with us.
All right. Well, thank you, Matt. And if I don't have a good answer, I at least can make up a good story or something. But I probably have an idea of something to tell folks.
Absolutely. And this is the fun part about it is I love how you say I'll make up a good answer, but I've known you and I don't think you make up answers. You are so set and you're so confident, and also you are so knowledgeable in everything that you do. It is such a pleasure to do this show with you. And I'm so floored and so happy that we get to do it. So once again, question and answers of your cancer topic. So we have a question that came in. And so Dr. Judy, would you mind if I ask you this question?
Go for it.
All right. So this question is Joan said, I just found out my dog has cancer. What alternative therapies should I explore?
Well, this is a very broad topic, and my treatment protocols are always customized to the individual pet, but there are some very important broad considerations. So the most important thing, hands down, is good nutrition, and that is feeding a fresh, whole food and ideally raw diet. And most dogs take to that really well. There's a few individuals we need to make some modifications. Again, we're always looking at the individual pet. We can make the best recommendations in the world, what we think are the best recommendations. If it's not working for the individual pet, then of course we need to make alterations. But nutrition is the first. There's natural immune system builders, such as mushroom supplements, turmeric. Turmeric can also help with inflammation and pain. There's certain specific ways you want to be giving these things though. So, and that's something that we could talk about in more detail, how that applies to your pet. I provide mistletoe injections, and right now I'm looking at doing things a little less hands-on, but I'm looking at beginning some outside curbside treatments. Weather's getting nice. My practice was out of my home, and I really do want to keep my home a safe zone and not infected. But I'm going to be offering some curbside and outdoor services. So things like ozone therapy that I do inside. There are some forms of giving ozone that I will be able to do outside the building. Some of them, like the blood treatments, I probably won't do. I want to do those in a little cleaner, more controlled environment. But the rectal administration, I can administer subcutaneous ozonated saline. That can be done outside. I can teach people how to give mistletoe injections at home. CBD is fabulous for cancer patients, but probably next to nutrition, I start pets on CBD because there's just so many benefits, so many anti-cancer benefits. It's just healthy for pretty much all the systems in the body. There's just no reason not to give it. It's super safe and super beneficial. So those are some of my starting points. And if somebody should choose to do the more conventional chemo, radiation, I don't do those therapies. I don't really keep up on the protocols enough to even talk to people about them, but you go talk to your oncologist. If you choose to go down that road, the therapies that I recommend can still be supportive. And I can discuss with you the pros and cons of doing a conventional approach and what results I have seen in cases, but it's not an either or. My approach is supporting the natural healing ability of the body rather than just attacking the cancer.
And that's incredible. Thank you. And so I also want to point out to everyone that if Dr. Judy does answer a question and you want more of a deeper dive into the therapy protocol that she mentioned, or any other type of treatment that she talked about, or curbside pickup, or not curbside pickup, but curbside drop off, in this current state that we are all in the the shelter at homes, to the lockdowns, to this quarantine of the virus. And so really with all of that, Dr. Judy is trying to help as much as she can and offering multiple ways that you can engage with her. And you can actually have a discussion with her in a deeper dive, $35, and really have a 15-minute consultation with Dr. Judy, and really help your pet get through some of these difficult moments as well, because cancer doesn't stop just because there's a virus. So I have another question that came up. Thank you, Dr. Judy. I'm a big fan of CBD, and I second that as well. We've noticed just since the launch of CBD and it really rising, we've seen some medical, I don't want to say miracles, but just medical benefits that come from CBD.
Yeah, I agree.
So Bill had a question. Should I look into painkillers during cancer treatment? And if so, what?
Yeah, that's a great question, because certain types of cancers can be painful. I mean, when we talk about pain in cancer patients, I think about a couple of things. One is, of course, is the cancer itself painful? And sometimes they are, and sometimes they're not. I've seen pets just not really seem to be reacting. Other pets be excruciatingly painful. And I look at, first and foremost, the quality of life of the patient. And I try to start with more natural pain remedies. So again, I'm going to go back to the CBD. CBD is excellent for pain. I try to get, pets, and this, both dogs and cats, on as high a dose as they'll tolerate. CBD is very safe. There's really no toxicity. It will sometimes, at some point, you might get a little bit of some grogginess. Just they're not quite as alert. I've seen some older pets get a little incontinent. Notice things like that. Back off a little bit on the dose, but there's no long-term toxicity. Things like turmeric. Turmeric is fabulous for pain. Inflammation is also anti-cancer, so that's a great one. Boswellia is a great anti-inflammatory. Yucca is a great anti-inflammatory. So I like to start with these natural treatments. Now, some cancers, such as bone cancer, are excruciatingly painful. And pain management is one of the toughest things with those types of cancer, because again, I'm looking at preserving the quality of life of the pet. So usually we do have to manage with some conventional pain meds. So I like to start with things like tramadol. Tramadol is like a very mild opiate. It's in that class. It's actually a controlled substance now, but it's not strong as like your Oxycontin or these highly addictive opiates that you hear about on the human side. It's more mild in that respect, but can be very effective. Sometimes we need to add in the more conventional non-steroidal anti-inflammatories, your Rimadyl, Metacam. There's several of them out there now. Sometimes using a couple of drugs in combination will lower the dose of each drug. So as long as they're not, they don't it doesn't increase the toxicity by giving them together. Usually there's some benefit by decreasing the dose of each medication. And we still do the natural treatments, because with the natural treatments on board, there's a good chance you're not going to need as much of the more conventional pain medications. But it's so important to keep our pet comfortable. If the pet's in pain, I feel like we need to do whatever is necessary to help reduce the pain. And every pet is different. There's different pain meds out there I see being used. Some are not so effective. So if the pet's on something and it's just not working, then we'll try some different combinations and come up with a good plan that's appropriate for the individual pet.
Mm-hmm. Wonderful. So really and this kind of my own curiosity a little bit, is you early on in that question, you started to talk about reducing inflammation. How much do you think inflammation plays a part into our pet's health? That, they're eating something, their stomachs are inflamed, they get a diagnosis of cancer, they have inflammation in a specific joint. Does inflammation cause pain, or is inflammation a subset of a diagnosis? I mean, how much does inflammation play into our health and our pet's health?
Oh, it's huge. I think all disease, it really is based in inflammation. And the serious types of inflammation are the whole body types, like where the gut gets inflamed, like from eating an inappropriate diet, kibble diet with poor nutrition. The gut's inflamed. You're going to get substances leaking into the bloodstream that don't belong there because we have leaky gut, and that inflames other parts of the body. And actually what you can get is what's called molecular mimicry, where the body will see, say, a protein gets absorbed bigger than the form it in a bigger form than normally it would be. Okay. And the body recognizes that and causes some inflammation, tries to eliminate it. But then there's a crossover where the body sees that protein as similar to a certain cell type in the body and then starts to attack that cell type. And that's autoimmune disease. And then the more inflamed the body gets, the immune system just can't function well. And then if we get some cancer cells, get some cells starting to mutate or to get damaged from this chronic inflammation, then they can lead into cancer. Cancer is actually like an end stage survival mechanism. The cells cannot survive using normal cellular mechanisms and energetic pathways. So they have to convert over to something. So they actually can get around the natural death processes in the cells. Yeah. All cells have some programmed death. It's called apoptosis. And the cancer cells have ways of getting around that and developing other mechanisms for survival, and they can just propagate out of control. And that's where we have cancer. Really is a survival mechanism. So when we start with this chronic inflammation, and the cells get sicker and sicker and sicker and sicker, and then finally they're like, okay, well, we can't survive in this environment. They then do a mutation and try to survive as cancer cells and can proliferate wildly that way.
I have never heard that explanation before given that way. Thank you very much. I didn't think that I thought cancer was just like a virus, like a riddled, like the cell actually mutates and then it propagates. And so from that side, but I didn't look at cancer as a survival mechanism to a damaged cell based on inflammation.
Yeah, well, and it can, there's some theories out there that cancer can come from viruses, but it's the same thing, because the virus goes in, viruses live intracellularly. That's why they're so hard to treat and so hard to eliminate, because you can't eliminate viruses without also killing the cells. And so that's what makes antiviral drugs really tricky to come up with, because you can kill the viruses, but then you're going to be killing a lot of cells. So the viruses that get in the cells and cause damage to the cells, conceivably viruses could definitely play a role in the formation of cancer.
And it triggers that survival mechanism that cancer then says, we are going to die unless we mutate in a specific way, AKA this is cancer. But the root is what you're talking about, is inflammation, is anything we do to inflame the body. Stress. I mean, you're looking at this moment of, all the stress that we are experiencing in today's environment. Well, your pets experience that stress as well, and experience your anxiety. So, and then on the other side is the food that we feed our dogs. I mean, you heavily processed foods. For example, if I eat cornflakes every day, it's not going to be long till I get cells in my body that are just not responding correctly, and then they mutate over the other way to try to keep themselves alive, which is aka cancer, based on what you said. So then it's everything we can do, that healthy lifestyle of eating a raw-based diet, or for our pets eating a raw-based diet the way that they were meant to be fed. And this basically reduces the chances of inflammation happening within the body. And CBD and turmeric and all of these different things are just outside elements that help reduce that inflammation that would spark that step towards cancer, that cell protecting itself.
Right. And things like, vaccines, some other pharmaceuticals, those things can all perpetuate this inflammation in the body as well.
Right. That I'm speechless. Like, this is just that question alone and how you explained it. It was worth every minute you ever spent on this Facebook Live. So everybody's watching.
I'm going to leave here with a big ego, Matt.
No, you should, because the way you explained it was understandable. So thank you. So I got another question. So this question comes from Susan. Should I stop other medical treatment during a cancer treatment?
Well, when I evaluate pets, I look at their whole history and all the medications that they're on, and we'll take a look at that and evaluate if it's appropriate. Now, should you on your own stop medications? No, absolutely not. You want to do this with some sort of medical guidance, because say your pet's on heart medication and their heart really isn't functioning well. You can't just pull those medications out and risk their heart not being able to do what it needs to do. Now, I do see sometimes coming from the conventional side, pets are put on medications and then they're just told they could be on those medications for the rest of their life. And sometimes some conditions we can clear up and they don't need to be on those medications, or we can reduce the medications. We can add in natural treatments and maybe start to back off on dosages, but that needs to be done gradually. And that absolutely needs to be done with medical guidance. So we want to, we were talking about inflammation, toxicity from pharmaceuticals. If we can eliminate pharmaceuticals, if they're not necessary for the pet in their current state of health, then yeah, absolutely. We're going to try to wean the pet off of those. But you don't just want to go, like, absolutely not. Don't take them off of medications cold turkey and without medical guidance.
Yeah. So really taking time with you and having a consultation and discussion about current situations that's happening with your dog, and also for you to get that wisdom to say, should I stop this? Should I not stop this? And having you be their guide along this process, because you're looking at so much information that's out there, is looking at a source that looks at it from a different angle, like Dr. Judy does, and looking at it from multiple angles and not just that singular possible view that you're receiving from one individual, which is very myopic, I believe, at some point, because you're going after their knowledge, their education, everything they have. Why wouldn't you spend $35 to help have a conversation with Dr. Judy that is very focused and very specific about your questions that you have? So this is an incredible opportunity for everybody that's out there. So I'm not seeing any other questions that are coming through right now. And if you do have one, we're going to stay on for about 5-10 more minutes and just put it in the comment section on the Facebook feed, and let us know if you have a question regarding anything. So Dr. Judy, is there something specific, like what is one of the number one questions you get asked by a pet parent that comes in under this moment? And I'm going to say stress. I don't know if I should go as far as panic, but I do know that if my dogs were diagnosed, there'd be some panic because I love them so much. And so what are some of the bigger questions that you see?
Yeah, there is panic, stress, panic, concern, overwhelm. I know people find out, or even if they just like find a lump on their dog and then they go to Dr. Google and research and get so much information that usually makes things seem a whole lot scarier. So probably, honestly, the biggest thing before we get started talking about treatment protocols is how long do you think my pet's going to live? And that's really important to people. They want to know how to prepare themselves, and it's a really tough question to answer because every pet is different. And what I tell people is, we have to start. So what I do is support the healing ability of the body. So a lot of that, the answer to that question depends on how advanced is the, disease state when pets come into me. And, that does affect the prognosis somewhat. I discourage people, honestly, anymore from completely believing the conventional medicine timeframes, because I see pets beat them all the time. So I see a lot of pets that come in, they've got stage 3 or stage 4, some type of cancer, and they got 1 to 3 months to live. And I see pets go way beyond that. I've got pets that go out more than a year when they come in with that kind of prognosis and with a good quality of life. So I think my best answer to that question is we take it day by day and we keep the pet's quality of life as good as we absolutely can. We don't want the pet to be suffering. I don't see good results with things like chemotherapy. I see a lot of pets actually get really sick from that. And I actually hear from my clients that have gone in to see the oncologist that will tell them that, oh, pets don't get sick from chemo. I'm like, what? Like, I see pets, I see people bring pets into me all the time. The reason they're coming into me is because their pets get extremely sick, sometimes nearly die from the effects of chemotherapy. And again, I'm not an expert in that field. So if you want that information about chemotherapy protocols, you need to talk to an oncologist, but I don't see great long-term results. I see short-term results, decrease in tumor size. Pets may feel better for a short period of time, but there's always a breakthrough. You might get a short-term remission and they always break out of that. And then the cancer cells that survive the chemo are the toughest cells. So they come back with a vengeance. And the thing about the chemo is that it runs down the body so much, the pet's got nothing to fight with at that point. So that's another thing that I will talk to people about when we're talking prognosis and how long does my pet have. I find the more conventional treatments they have, the poorer our results are, the more surgeries or, medications and other types of interventions, because it just runs down the pet's body. And I actually see the best results when people come in and I say, okay, let's turn this into a condition that can be managed for the long term. Let's not, try not to panic about, oh my gosh, my pet's going to die. Let's create this or turn this into a condition that the pet can live with. Yes, we may have a mass there, but let's not so much worry about removing the mass, because the mass is just the tip of the iceberg. And we have to treat it as a systemic disease. And by building up the immune system through good nutrition and some of these other things we've been talking about, we can help stabilize the condition and make it something that the pets can live with and have a very good quality of life. And that is my ultimate goal.
That is awesome. And while you were giving that, we had a question that came in, and it's from Brenda. Brenda, I'm going to screw up the first part of your last name, Geron.
Wow.
Prince. So She has a question. Do you believe chemotherapy when your dog is feeling fine, not showing any signs of feeling sick?
So I'm assuming she's asking would I recommend it if the pet is not acting sick? That's what
Sure.
she's asking. So no, I wouldn't. I mean, I'm assuming that the pet would have a cancer diagnosis if chemotherapy was recommended. But if the pet has a lot of vitality, feeling really good, we have found a mass and there's been no symptoms, I wouldn't do it. I have seen those pets that are super healthy with that much vitality. We can support the healing ability of the body. And a lot of times we can control the progression of the cancer.
That's awesome. Thank you. So we want to thank everybody for watching the show today. And Dr. Judy, if somebody does want to engage with you because your practice is still active, you are actively seeing patients, and you're just doing it in a different kind of thread. You're doing some telemedicine where you're having a discussion face-to-face with somebody from a distance over the internet, and also having animals dropped off at your house or curbside pickup, different things like that. So you are still live and active. So if somebody wants to engage with you, what is the best way for them to get a hold of you? And I'll type it in the comment section.
Okay.
Why don't you tell me?
Well, first of all, you can go to my website. I have a brand new website and I'm really excited about. I'm doing a whole rebranding. It's Animal Healing Arts. So that's ahavet.com. The email is info@ahavet.com. And the phone number is 720-515-2421.
All right. This is what you get with doing a show with me, Dr. Judy. I your URL typed in. So www.ahavet.com.
Right.
Email is
info@ahavet.com.
Okay.
So you already have some practice typing it in. So
you would think I would just remember that as simple as that. But you know, I get excited about these shows. And the phone number?
Phone number 720-515-2421.
2421. All right. So I'm sharing that with everybody. So if anybody that is watching the show wants to engage with Dr. Judy and have a conversation, if it's something bigger or anything, it doesn't even have to be about cancer. If you've got a concern about your dog and you're talking about going in, or you don't want to go see your vet because of the entire, the lockdown, quarantine at home, all of those types of things, you can have a conversation with Dr. Judy and reach out to her, call her, email her. She can schedule something on video chat with you so you can actually engage in her telemedicine program.
Absolutely.
So I'm going to look real quick, make sure we don't have any more. Yeah, so Brenda is going to go there. She has some concerns about her sweet boy. And Brenda said it right. Our pets are family. They're such a part of our families every day. And so everything that we can do to help them. So thank you, Dr. Judy, I love the show. So we want some feedback regarding the question and answer show that we just did. If you like it, give us a thumbs up. If you want to actually have us talk about a specific topic, just write the topic in the comments. We follow it and we look at it. So put the comments in there and let us know what you want to hear, what you want to talk about. Brenda, thank you very much for your feedback in regards to wanting to know more about this. We love you all, and just stay healthy during this time.
Absolutely.
And follow, that social distancing, take your pet for a walk, reduce your stress as much as possible, because it'll help your pet along every journey and every path that they're going under. All right. Well, thank you, Dr. Judy, so much for your time today. I so appreciate you, and I so appreciate all the time you spent with us.
Thank you, Matt.
All right. So enjoy. Everybody stay healthy and safe.